Hey there, Dr. Sean Frawley here with Beverly Hills Dentistry. And I want to talk about something, and that's the idea of veneers or crowns coming off. This has actually come up this week a couple times. We've had a couple emergency calls of patients that are not our patients of record, but that veneers come off, and getting to talking to them, and they're asking, is this normal, and why does this happen, and this and that. So I thought this would be, an opportunity to discuss the cementation process, and is it normal for veneer to come off or crown to come off? The answer is no, but there's reasons why it happens. Starting from, and we can go as far back as when you design the case, you prepare the case, the impression you take. But say you do all those things well, which you need to do to have a good outcome. But it's really the cementation is the last thing that really ensures that you're going to have a long-lasting veneer crown and a smile, because you don't want to deal with something coming off. It's not a fun thing, and it's never at the right moment. Not there is one, but it's you're at an event, or getting married. Anyhow, so I want to share a couple things. When you get your restoration cemented, it's not a quick process. At least it shouldn't be. In our practice, it's a very detailed. It's very labor intensive, because you need to control a lot of things. It's a pretty simple concept. When you're cementing something, it's similar to gluing, and if you have moisture, which in the mouth there happens to be a little bit of moisture, it's going to affect the way that bonds or cements adheres. So these things have to be controlled. In addition, you need to have a clean tooth surface. You've most likely, if they're veneers, you've had temporaries on. You have temporary cement. You have to take all those things off. The gums can be a little irritated, especially if you're not taking care of things, or the temporaries weren't made well. So for us, one of the things I want to show you. So this is an air abrasion system, and we use this actually in every procedure we do. Any adhesive dentistry we do, whether it's a filling, crown, veneers, and what it does is it cleans. So this shoots out a little bit of pretty much sand and water, and it cleans off the tooth. You could actually use it to remove cavities. We don't typically do that. It's more to clean off the tooth, because when you've the tooth is never clean. If you've been cutting, removing decay, there's little particles there. When you've removed temporaries, there's cement, and so if any of that is there, you're not only going to not get a good bond, but you can have sensitivity. A lot of times you've had dental work done, and then you have sensitivity. It could be because of being close to the nerve, but a lot of times it's because you don't have a good bond. That there's some schmutz there that interfered with the cement adhering well. So this is air abrasion. We clean this well. It's very important. There's a lot of moisture that comes up from the gum line in addition to the rest of the mouth. It's really important to keep things well isolated. So that's using a rubber dam, if you've heard of that. Isolites. We use other things to isolate the teeth, because if there's any moisture, it's going to affect the bond. And I can honestly say there's not a veneer that I can recall in our practice, and as far as I can remember, that's come off. It can chip, the porcelain can chip, but not just straight come off. I think I've maybe had one or two crowns come off, but that's not a typical occurrence in our practice. Another thing that can influence that is the way the teeth are prepared. If you can be as minimally invasive as possible, leave as much enamel. If you're cementing to enamel, it's much better than cementing to dentin, or the inner part of the tooth. So that goes back to your plan and design for your case. So if you can be more minimally invasive, that's better. It also ensures a better cement. What else? I think that's it. If there's any questions about this, reach out. Hopefully you don't have a tooth come off, but if you do, maybe one of those things happened. Hope everybody's off to happy 2022. We'll talk to you soon.